to you all. Hope you all are doing very well today. So, it's okay. After my topic, you will be fine. So the topic today, me and my friend will present is the organophosphate poisoning. So that's me, Youbab, which is my roll 65, and my fellow friend Samreen. So. So in the presentation, the 5 topics we will discuss with you people. So the first one is the organophosphates, what organophosphates are. Second is the organophosphate poisoning. Third are the symptoms of the poisoning. And the last is the treatment of the poisoning, how to treat the organophosphates. Okay. So first, let's discuss about the organophosphates. What are the organophosphates? So organophosphates are chemical compounds that control insects. They are typically used in agriculture or household items like anti-cockroaches sprays. So they are also used as the nerve gases. They disrupt the nervous system of the mosquitoes and other plant pets. These chemicals are poisonous and may be lethal to humans. The last one is the organophosphates are more commonly used in society. So if anyone wants to plant, they can use this. I'm just kidding. So the common organophosphates, which is very common in our human world. So the common organophosphates that are very harmful for the human includes oh, it's very difficult to pronounce. Diazonium, catione, malatione, and parathione. Oh, it's very difficult for me to pronounce. Okay, so now let's talk about the organophosphate poisoning. What is organophosphate poisoning? So exposure to a large amount of these chemical compounds can poison your body and make you sick. You may absorb organophosphates in 3 ways: inhalation, skin contact, and ingestion by eating or drinking. Now, there is a question to explain to you that how it basically works. How quickly you experience symptoms depend on the types and amount of exposure. Example, if you are a farmer, I know you are not a farmer, you are a doctor, but just imagination. If you are a farmer spraying organophosphates to prevent insects from destroying your crops, you could end up inhaling the poison you could end up inhaling the poison if the wind changes suddenly. If you inhale a large quantity, you may notice severe symptoms immediately. The symptoms we will talk about in the next slide. Yeah, so these are the symptoms if you inhale the organophosphate. Symptoms often occur within minutes and sometimes persist for weeks. So the earliest symptoms which occur within 24 to 96 hours are watery eyes, small pupils, nausea, vomiting, muscle tremors, and confusion. And the symptoms that may persist for weeks or months included anxiety, tiredness, headaches, hallucinations, seizures, slow breathing, circulation problems, and muscle weakness. To learn these symptoms, to remember these symptoms, just take this example, the dumbbell. It's very easy for you to remember this. Dumbbells is for like D for diarrhea, U for urination, M for mysis, B for bradycardia, H for bronchospasm, E for encephalitis, lacrimation, and so on. It's very easy for you to remember this. So the first day will be introduced to you by my fellow friend Samreen. She will discuss this. Samreen.
Presynaptic. Presynaptic and postsynaptic. From presynaptic, the acetylcholine is releases from the presynaptic, and we have the receptor for the binding of acetylcholine on the postsynaptic. So the acetylcholine is binded with the receptors, and the stimulation of receptors may result the increase in the parasympathetic activity. The increase in the parasympathetic activity. To overcome this, we have a mechanism, the acid degradation mechanism. For acetylcholine, that it having the enzymes that called acetylcholinesterase. estrase, and with the help of this enzymes, that the degradation also happens, right? So that is the normal mechanism. But what happens in organophosphate? The organophosphate binds with that acetylcholinesterase and it blocks the acetylcholinesterase. When it blocks the acetylcholinesterase, then we have in the parasympathetic that the acetylcholine is accumulated in neuromuscular junction. When acetylcholine is accumulated in neuromuscular junction, then what happens? The parasympathetic activity is increases. The rest to digest system is increases. So for this purpose, we using the drugs. For example, when organophosphate is bind with that, it blocks the acetylcholinesterase. So the pradexone is the drug we use in 24 hours before aging. With this, the organophosphate block it reversibly. When it block it reversibly, after some times the aging happens. Aging, what is aging? The phosphorylation thing. The phosphorylation, they having the ethyl group, release of ethyl group, and the loss of an ethyl group, we can call it aging. So when aging happens, we can do nothing. After the become more worse, for example, we have the respiratory failure in the patient, we have the muscle weakness in the patient, we have in the for after like 2 weeks we have in the peripheral neuropathy or lack of legs in the patient. So to overcome this, we have we block that acetylcholine, we know that it's blocked, is blocked. So what we can do, that if we use a drug reversibly, when we have in 24 hours, okay, to treat that drugs or to treat the patient, it was easy for us. We treat it with pradexone after the 24 hours we have that aging. The diagnosis is very difficult. We go for atropinization, but we having some kind of very difficulty in managing the patient situation, right, at that time. So what is the atropinization? As you know, it was an IV administrated drug. We have given the dosage is different in adults, it is different in child. So in adult it was like 0.2, so it was 2 milligram to 4 milligram, and in the child we're giving 0.02 to 0.05 in the child. So that drug, if for example, if we have in the patient of acute pulmonary edema. What was acute pulmonary edema? Acute pulmonary edema is some kind of condition of lungs, right? That have in which the fluid is accumulated in our lungs, and the patient come to you like that. They say child. So in adult it was like 0.2, so it was 2 milligram to 4 milligram, and in the child we're giving 0.02 to 0.05 in the child. So that drug, if for example, if we have in the patient of acute pulmonary edema. What was acute pulmonary edema? Acute pulmonary edema is some kind of condition of lungs, right? That have in which the fluid is accumulated in our lungs, and the patient come to you like that. They said they having the chest tightness. They when they speak with cough, right? They speak with the cough. They having the sputum in their cough. So we just go. First of all, the doctor go towards that diagnosis. That was we use oxygen mask to prevent, to clear the airways, right? So if we having the acute pulmonary edema patient, we give the dose 1 to 2 milligram for 15 to 30 minutes, right? So for atropine, we give the atropine 5. After 5 minutes, we double the dose after 5 minutes, and we just until the secretion is clear. First aid treatment for organophosphate poisoning. The first step is decontamination, as I told you. The clothing will be removed and destroyed, as the chemicals can remain on your clothing even after washing. The doctor may decontaminate patient skins with water, or use floor sand, or bentonite clay. If a patient ingested the poison, then she may be experiencing symptoms such as vomiting. As I told you, the patient comes to you with the continuous vomiting, loose diarrhea, GI distress, which decontaminate the patient digestive system. The doctor will use intravenous fluid, IV fluid, and take a blood sample and then put it in IDTA tube, and in the body on I 4 degrees Celsius. The doctor will use intravenous IV fluid to help flush patient system and remove any additional toxins. The doctor will monitor lungs and airways. Meanwhile, if patient experiences any kind of spasm, the monitor the lungs and airways and use the O2 to clear that all kind of to clear the secretions, the harmful secretions in our lungs. Spasm or seizures, bronchospasm, then the patient may need to be intubated. This procedure involves placing a tube in a patient's throat and one pipe to open the airways and help patient breathe. Sometimes a drug called atropine is used in organophosphate. Atropine is an anticholinergic drug. It reduces the parasympathetic activity, it reduces the parasympathetic activity and relates to and move towards the pupil dilation, from pupil constriction to pupil dilation. So, use an organophosphate antitube to help stabilize breathing. Another drug called palidoxime and pralidoxime can reduce neuromuscular symptoms. Palidoxime is effective when we give to the patient before 24 hours. Before aging, we give the patient pralidoxime. It is very effective. After 24 hours, it is ineffective. We don't give the pralidoxime to the patient. Again, reduce the neuromuscular symptoms. If patients experiencing seizures, then doctor may use certain benzodiazepines like Valium or Xanax to prevent and stop the symptoms. Next. Presynaptic. Presynaptic and postsynaptic. From presynaptic, the acetylcholine is releases from the presynaptic, and we have the receptor for the binding of acetylcholine on the postsynaptic. So the acetylcholine is binding with the receptors, and the stimulation of receptors may result the increase in the parasympathetic activity. The increase in the parasympathetic activity. To overcome this, we have the mechanism, the acid degradation mechanism. For acetylcholine, that it binds having the enzymes that called acetylcholinesterase. We have an enzyme that was acetylcholinesterase, and with the help of this enzyme, that the degradation also happens, right? So that is the normal mechanism. But what happens in organophosphate? The organophosphate binds with that acetylcholinesterase and it blocks the acetylcholinesterase. When it blocks the acetylcholinesterase, then we have that the acetylcholine is accumulated in neuromuscular junction. When acetylcholine is accumulated in neuromuscular junction, then what happens? The parasympathetic activity is increases. The rest to digest system is increases. So, for this purpose, we using the drugs. For example, when organophosphate is bind with that, it blocks the acetylcholinesterase. So the pralidoxime is the drug we use in 24 hours before aging. With this, the organophosphate block it reversibly. When it block it reversibly, after some times the aging happens. Aging, what is aging? The phosphorylation thing. The phosphorylation, they having the ethyl group, release of ethyl group, and the loss of an ethyl group, we can call it aging. So when aging happens, we can do nothing. After the become more worse, for example, we have the respiratory failure in the patient, we have the muscle